Well, this is an alarming trend. Do-it-yourself teeth straightening.
The American Association of Orthodontists has issued a consumer alert warning against it, since attempts to self-treat could result in permanent tooth loss or other major dental problems.
It can be dangerous. And Dr. Kort Igel is an orthodontist and member of the AAO. Good to see you, Doctor.
Nice to have you here.
Thanks for having me.
Thank
I had
you.
no idea that this was happening. People are trying to straighten their teeth on their own. What do they use? Rubber bands and
They're using toothpicks, dental floss, string, wedges, anything they can to try to move their teeth by themselves. And the American Association of Orthodontists has received numerous complaints from the orthodontists about what's going on, because people are getting it all off the YouTubes and trying the things, and all it's doing is causing problems. And we have a case that we're going to show you here in just a little bit that had cost up to $25,000 to fix the problem just because they were trying to close a little gap between their two front teeth.
How do you know it's on the rise?
The number of orthodontists reporting it to the American Association.
People coming in to get it fixed after the fact.
Yes.
You must be mortified as a professional to see what people are doing, what they're up to.
I've been practicing for over 25 years and you're never surprised.
Really?
Things just keep happening.
Really?
So what kind of problems does it cause?
Well, you think of the tooth being in, basically showing you a model of what the teeth are. The teeth are at certain positions. The problem is that each tooth is in the bone with millions of fibers supporting it, then the gum tissue over it. You try to do these kind of things, and it just causes some horrible, horrible problems because you don't know if there's infection problems. It'll take bone away. There's so many physiological things that you need to study to know what you're doing. Just jamming teeth together isn't the right way. There's a certain force that should be applied to do it physiologically.
Yeah, there's a way those teeth come together naturally, forced naturally, but yeah.
We have some pictures to show you, and the first one's not so bad, but as you'll see the subsequent images, they get a little bit more graphic in nature, so we just want you to be aware of what you're looking at. This is an actual case, so set this up for us, Doctor.
The patient presented to the office, I don't know why these teeth are doing this, and I talked to the parent a little bit about it. They thought it was trauma at one point, and then I saw a photo or an x-ray from the dentist before showing the teeth were together nicely. So the teeth started extruding or pulling down and pulling out, and noticed that something was going on. I spoke to them, figured out they were trying to do a little DIY to try to fix the gap themselves. And what happened was, I tried to figure out what was going on. I said, did you try some rubber bands at home? Well, yeah, but I took care of that. Well, she didn't. And they'll go...
A warning on this next picture. What are we looking at here?
This is the view from the periodontist I worked with, got up in there and found it. There were 3 rubber bands at the apex of the teeth. Basically what happened is that the rubber bands had migrated up to the tip of the root and basically extracted those 2 teeth. This patient, those were the villains right there.
You pulled 2 rubber bands, came out, and that's why it was pulling those roots together.
So then you had to do some major work to get that. What did you have to do to get these teeth back to normal?
Well, I think the next photo is going to show you that that's the finished product after I got her back. But the periodontist had to put in graft bone in, graft soft tissue in, costing over $20,000 total on everything, and it could have been done much less expensive if it was done right by an orthodontist.
Well, let's talk about some of the options that are available, the safest and the latest options now available in braces that you want people to know about.
Well, just that it's much less expensive than it was before. Most orthodontists will give you interest-free loans to pay for things, a payment plan for it. There's also a thing provided by the American Association of Orthodontists that people that are in need can apply, and orthodontists will do pro bono for certain numbers, and it's a nice service that we do, but we want to do it for people that are that really need it.
And then in terms of the technology, braces aren't what they used to be.
No.
They used to be remember? What was
remember? Nobody remembers.
Yeah, I don't remember.
I think it's a Brady Bunch where there's a mouthful of silver brackets and all kinds of stuff.
That was over-exaggerated, but now you have, this is a typical set of the braces that I use in my office, and they're clear on top. You can get clear on the bottom. Usually I don't. But you have Invisalign, which are a series of aligners that will move the teeth gradually over time. They're much more physiologic. You don't need to be seen at the office as often as you did in the past. You can go up to 8 weeks for every appointment, so it's easier it's more efficient for people with busy lifestyles. And there's so many different options, so much softer forces, more efficient forces being used these days. And early treatment is a very important thing to prevent some of these problems later, and that's the big trend in orthodontics now, is to get them early, open things up, create room for their teeth and opening up their airways as well.
But on that same note, there's a lot of people out there that didn't take care of this when they were younger, and maybe in their 20s, 30s, 40s, even 50s, they can do something about their teeth too.
Oh, absolutely. I have numerous adult patients. About a third of my practice is adult patients, some up to as old as 70.
Yeah.
And the point is, do you want to keep your teeth till you're 100 years old, and that's a
Yes.
guesstimate, then having them straight would help them be easier to clean and keep them much longer.
I noticed one more thing you brought in. What is that?
This is called Excelident, and what it is it's a minor vibration device that causes teeth to move up to 50% faster. So people say, well, I want to try to do it myself, I'll make it faster than the orthodontist. Well, this product, you use it 20 minutes a day, causes the teeth to move 50% faster, and it takes away most of the discomfort as well.
Do you use that in conjunction with the braces?
Yes, you hear like football players that will lose, break a bone, and they're coming back in 2 months to play football again. How do they do that? Well, they use the device like this. It's a vibrational technique that causes bone to turn over more quickly and heal faster. Tooth movement is movement of tooth through bone, therefore the same philosophy applies.
That's
sense.
incredible.
Yeah.
Let's show our viewers where to find you. But I know you have some other colleagues that might be in the area. You can't see everybody.
Yeah, no.
You recommend some of your colleagues too.
The American Association of Orthodontists has a good list. I think it's My Smile, whatever. Go to the AAO and
here's the website.
Find an American Association of Orthodontists licensed orthodontist. That's the important thing. They went to accredited orthodontic program after dental school, up to 3 years more, to be a specialist in this. There's a lot of intricacies involved in orthodontics, and you should see a specialist for it.
That website is mylifemysmile.org. Let's show them where to find you, though, in case today they're like, I like that guy on the morning flight. I want to go in to see him.
Well, thank you.
HeigelOrthodontics.com, that's the website. You're at about 108th and Pacific. Give them a call, 402-330-1152. Doctor, thanks for coming in. And
Thank you for having me.
Great reminder, great tip. Don't try to fix your teeth yourself.
Yes.
Go see a professional. Doctor,
Thank
thanks
you
a lot.
so much.
Thanks
Have
for
a nice
having me.
weekend.
You too.
I guess in the morning.